How does therapy work? For mental health improvements, research shows that therapy can be as effective as anti-anxiety and antidepressant drugs. And some studies suggest that it can be more effective than medication over time. But there's surprisingly little evidence for exactly how therapy works. And believe me, researchers have tried to figure this out. There have been a lot of studies over the past decades that have attempted to isolate specific evidence-based ingredients of therapy. But many of these have reached a kind of disappointing conclusion, that all psychotherapies have roughly equal effects. This is known as the dodo bird effect, named after the dodo in Alice in Wonderland who declares after a race, everyone has won and all must have prizes. So all therapy is effective for some, but no therapy is effective for all because people are different. Some of us will benefit most from a more emotion-focused approach, others from a more cognitive approach, etc. So what this research doesn't provide is a way to work out which kind of therapy is best for you. That said, there is one element that almost all researchers found to be crucial for success in therapy no matter which approach you take. And that is the relationship you have with your therapist, known as the therapeutic alliance. In other words, if you're seeking therapy, probably the most important thing to look for is just a therapist that you feel like you click with. Years of experience just don't seem to matter as much as connection, warmth, and empathy. But it can be hard to find that kind of relationship, and this of course is where digital mental health offerings tend to struggle. It can be tough to create that kind of relationship with a computerized character or bot. Tough, but not impossible. One study, for example, found that users of a well-known CBT app felt a connection with the therapy bot that was comparable to that experienced in face-to-face therapy. I should mention that there were some conflicts of interest in that study, but it's interesting nonetheless. And we wanted to understand this better for ourselves. So since we launched Betwixt in June, we've spoken to lots of people who've used our app for various different reasons. And a number of them have told us that they felt drawn to a mental health game, either because they didn't yet feel ready for therapy, because they couldn't access or afford therapy, or just didn't like the sound of it. Now, some of these people report high levels of anxiety, and we've learned that it's because of this that they can feel uncomfortable or too exposed during face-to-face therapy. They've told us that they can't relax and they find disclosure difficult because they're constantly wondering what their therapist thinks of them and they can't shake the feeling that they're being evaluated and judged. Others were skeptical because they felt like just one of many paying clients and they couldn't really believe a stranger would be able to genuinely care about them. None of this is to say that therapy is broken or useless, because it obviously isn't. But it's important to recognise the very real obstacles people come up against when considering that route, especially seeing as surely these are the people for whom mental health apps will be particularly important. I need to very clearly state that we did not create Betwixt as a replacement for therapy. We don't think any digital program can claim that really. But it's also been surprising and completely amazing to hear from so many users who feel like they've made more progress with a free app like ours than with expensive professional help. And we think that the lack of judgment must be key. That it's easier for some to work through their issues effectively when they're doing it from the privacy of their own home without another human being observing them. And if this is the case, then it surely means that apps and online programs do have the potential to offer quality, accessible care, which is a good thing because we've never needed it more than we do right now. But we believe that there's more to it than just that, and that the format and setting are also really important. We think that story and or play must play a part in the future of digital mental health if it's going to be successful. One of the reasons we built Betwixt as a choose-your-own-adventure game rather than a simple conversation with a chatbot is because, especially for people with active imaginations, storytelling and creativity can be powerfully transformative things that are often missing from mental health apps and even traditional therapy. Ultimately, cognitive work and rational understanding are important, but they don't always lead to lasting changes, which need to be embedded and embodied on a deeper level. Story helps us to do this. Imagery and metaphor help us to do this. So this is where we think digital mental health is headed. We imagine a future with more and more games like Betwixt that offer judgment-free creative spaces, playgrounds to explore our minds, our thoughts, our feelings. If you agree, please come along for the ride. You can find us in the app stores and in our Discord community.